Thank you for inviting me, first of all. Just in 5 short minutes, I'm going to introduce the National Healthcare Institute to you. And the National Healthcare Institute is a governmental body, but it's, well, sort of independent from the ministry, so it's really a different organization. And we have 4 main tasks, which are here. And I'm going to focus on the first one, in which I'm involved, which is to improve the healthcare quality. And of course, we don't provide healthcare ourselves. In the Netherlands, the healthcare providers are not part of the government, so we have to have different means of trying to improve the quality of care. And we do this by assessing healthcare quality instruments. We have a register for that. We draw up a multi-year agenda with parties in the whole of the Netherlands to see which subjects need more attention from all parties. And we make quality transparent by publishing quality data. And this is what it all revolves around. In our healthcare system, there are sort of 3 markets. So there is a healthcare insurance market, a healthcare delivery market, and a healthcare purchasing market. And the idea of our health laws is that transparency on the quality of the healthcare is important to all these 3 markets. So that's why we work on getting those data transparent. The care providers, of course, measure the outcomes of care, and we publish the data in a public database. And we also have Kies Beter, Choose Better, which is a website for patients to also distribute the data. But of course, a lot of other parties, like patient organizations, also use the same data to make it even more approachable to specific patient groups. Then there was a question about what projects we do that have touch points with the things you are doing. So I made a slide that really doesn't really comply with the standards of making a good slide, but I just wanted to mention all these things. In research, we have 2 main things going on right now. We have a subsidy program on transparency on quality of healthcare, which is running for 4-5 years. And we have 3 rounds done now, or at least they have started. So there are a lot of projects running in that program. And I myself, I've started a research project on the success factors of the use of outcome information. So there's a research organization doing that research right now. We have 2 large programs running in our organization on outcome-focused healthcare and specifically on the quality information in nursing home care. And then here are some other projects that I really wanted to mention to you. We're right now redefining our vision on stimulating the quality improvement, because we have a register, we have an assessment framework, but how can you support quality improvement as a government who is not really there with the doctors and the patients? So we're thinking about that. I think it's really interesting to also hear from you. What do you think that the role should be of a government? It's always good to have a fresh insight. Then we're also focusing now on the effectiveness of medication and how registries on that can also help improve quality of care and also contain costs of care. And finally, we're also participating in a consortium with a couple of organizations who make the state of public health and healthcare, in which we combine all a number of different data sources with indicators on the whole of the care in the Netherlands. So that might be interesting as well for you. And I have 4 seconds left on my counter. So yeah, so that was it. and hope to talk to you later on.